Among the issues impacting veterans is drug addiction, and one of the focal points of President Trump's administration has been battling the opioid crisis. The most recent data from 2017 by the CDC show drug overdoses killed more than 70,000 people in the U.S., a record high. That includes 28,000 deaths from fentanyl or similar drugs. We're looking at how one city hurt by the epidemic, Dayton, Ohio, has responded. Kate Wedell covers the opioid crisis. She's an investigative reporter for the Dayton Daily News. Katie, thanks so much for joining us. Over the last year, what has Dayton done to combat the opioid epidemic, and what have been some of the results?
Well, Dayton's approach really has been a coordinated response. They have a community overdose action team that has brought together everybody, law enforcement, social services, the city, the county, to all be around the same table, and that way they can address issues as quickly as they come up. One of the biggest things that has really impacted the number of deaths that we've been seeing here is the availability of Narcan, and really having every first responder in the region have Narcan with them, and family members and friends of addicts having it as well, and knowing how to use it. That's made a huge impact in the number of overdose deaths that we've seen, which has been cut in about half.
And remind us what that is again.
Narcan is just the drug that reduces overdoses if given when somebody is in the midst of an overdose. It can block the receptors of the drug, and really it's like somebody comes back to life.
Well, here's what President Trump had to say about drug overdoses and opioids at last year's State of the Union.
In 2016, we lost 64,000 Americans to drug overdoses, 174 deaths per day, 7 per hour. We must get much tougher on drug dealers and pushers if we are going to succeed in stopping this scourge.
So President Trump saying there that we need to get tougher on drug dealers and pushers. I wonder, based on your reporting, is the federal government's focus on law enforcement effective in fighting the opioid crisis?
I mean, definitely we've had some big busts of drug dealers here and gotten the fentanyl off the streets, which is really what was leading to a lot of the deaths. But the approach here has really been more well-rounded than just focusing on law enforcement. Everybody here kind of recognizes that you can't arrest your way out of this problem. You really have to also be working on prevention, treatment of people who are currently addicted, and helping getting them into recovery.
Well, in October, the president signed a comprehensive bipartisan bill to combat drug addiction. Has the bill had an effect in Dayton, and was it well received by people in that city?
Yes, I mean, our two senators here, Rob Portman and Sherrod Brown, were integral in that piece of legislation. They both had bills that they introduced that have really been impactful here. One of them, the CRIB Act, was something that allowed for centers that treat babies with neonatal abstinence syndrome to bill Medicaid, and that's something that was a need that was identified in the community, saying, hey, we have these babies and we need to have a better way to treat them, and also reconnect them with their mothers and get them into recovery as well.
And what role did Ohio Governor John Kasich's expansion of Medicaid play in helping those suffering from addiction?
That's been huge. I mean, everyone here agrees that that Medicaid expansion has helped thousands of people get into treatment that wouldn't otherwise have had health coverage. It's one of the first things they do here when they find somebody who says, hey, I need help, I want to get into treatment. They immediately get them to a case manager to sign them up for Medicaid.
And Katie, I know in reading a lot of the coverage that you and others there at the Dayton Daily News have done on this issue, you've been looking at this for quite some time now. The bottom line here, what seems to work when it comes to combating opioid addiction?
Well, like I said, they're really taking a team approach that it needs to be everybody in the community buying into, looking at this as a public health crisis is really the model that they're using, as if there were some sort of outbreak or something that had hit the community. That's really the approach that they've taken here. So everybody that encounters someone who may be suffering from an addiction is immediately thinking, how can I help this person get into treatment, get the services that they need need. Instead of arresting them, instead of throwing them in jail, how can we better spend our money on helping that person get into treatment?
All right, Kate Wedell, thank you so much for your time, Katie.
Thank you.